Hi Trevor, thanks for joining me this evening. It's great to have a chance to talk to you about BAPEN and raise some awareness during our special dedicated week for home artificial nutrition this week. So hopefully I'm just going to ask you a few questions to give some insight and raise awareness about BAPEN with our PINNT members and broader patient audience. So thanks for joining me.
Yeah, no worries. Thanks very much, Carolyn. It's great to see you on a Zoom call again. We never get to see each other in person anymore, do we? But really pleased to be able to join you. Thanks for inviting me, and well done for, well, by the time this goes out, another really good hand week. So it's really fantastic.
Thanks, Trevor. It's a lot of work at the moment. I'm hoping we keep to schedule, but there's a lot of exciting things coming across. So let's start with the first question. Could you give us a bit of a background about BAPEN and PINNT's involvement, just to give people an insight that aren't familiar with it?
Yeah, so BAPEN, well, but I've worked with BAPEN for a long time, but Carolyn, you've been, I think, part of BAPEN, and PINNT have been part of BAPEN since it set out on its journey. The background, probably many people don't know, but the King's Fund, which is a well-known healthcare think tank based in London, conducted a report or completed a report on nutritional care in 1992. And I mean, interestingly, the themes and the learning from that report back, well, virtually 30 years ago now, probably very relevant to this day, in that they identify that nutrition is an important part of people's health and social care, but healthcare was the particular focus at the time. They identify that there are some people where nutritional care, but particularly nutritional support, is life-saving and life-sustaining, and that's obviously of particular relevance to your organisation and to your members. But they also identify that there are lots of gaps in services and that the NHS needed to have a better structure for nutritional care. And importantly, that there's a nutrition team, so a team of healthcare professionals, nurses, dietitians, pharmacists, clinicians, medics, working together to bring the best possible care, safe care, quality of care to patients. And they were very clear that that was really important in terms of people's lives, but also the kind of healthcare outcomes that the NHS should be achieving, but also linking that to the finances as well. And we, you know, there's always been a focus on the finances of the NHS, but the King's Fund are really clear that actually by investing in nutritional care services, not only do you improve people's lives, but you ultimately also save money. So you might say that's a no-brainer, and I said a few minutes ago, you know, these issues and principles remain, don't they, in sharp focus to this day, and we haven't got it right. But in part of the outputs from the King's Fund and the questions around how do we put it right, then that's where BAPEN was born, essentially. So it was born out of that really important landmark report that brought together healthcare professionals and importantly also patients, and PINNT have been a core group of BAPEN right from the start. So that was BAPEN's starting point and point in history, 1992, and next year will be 30 years of that, you know, really fantastic achievement, and PINNT have been there right from day one.
I'm feeling my age, Trevor. I sat on that working group.
You did?
I was on
There's
the
a
King's
photo
Fund.
somewhere.
Yes, it's not very flattering, but it's definitely been recorded. So that's brilliant. And I think that was the landmark document, as you say, that's been the foundation of BAPEN, and BAPEN's moved on from there in lots of different activities and projects. So mentioning that, so can you give us a brief overview of what actually BAPEN do?
Yeah, so, you know, I talked about the King's Fund and the healthcare professionals that contributed to that, and the need for multidisciplinary nutrition support teams. So BAPEN, essentially, if you like, is a national
MDT
support team. That's how I think of it, but also with patients and patient representative, i.e. PINNT, at that table and an equal member. So BAPEN's structure is essentially to have core groups. So PINNT being one, obviously, another being the dietetic group, another the pharmacy group, another the nursing group, and then a medical group. And they all come together to form part of BAPEN's core structure, core groups. And then we have committees on top of that, and committees that have specific kind of themes within nutrition support. So one is BIFA, which is the British Intestinal Failure Alliance. So they focus very much on intestinal failure, home PN, and supporting healthcare professionals predominantly in hospital practice. There's what we call the NG-SIG, so the Nasogastric Tube Specialist Interest Group. They all kind of have slightly strange names, don't they? Yeah. But again, that is a multi-professional, multidisciplinary group that focus very much on safe care and supporting teams for NG-tube practice, both in hospitals and in communities. And then there are other groups, and another group that you and PINNT have been part of in the past is BANS, so the British Artificial Nutrition Survey. And that has been a really, really important activity for Baypen in terms of how we've understood some of the gaps in care for patients receiving artificial nutrition support, particularly relating to home parenteral nutrition. And that's been one of the really important drivers for some of the changes that we've seen in intestinal failure and home parenteral nutrition services over the last, 10 years or more. So that's some of what Baypen does.
And they're probably more relevant to some of the services and types of treatments and pathways that some of our members would be more familiar with. Obviously, a lot of the other Baypen work connects into that, but some of the more obvious stuff for the home perspective obviously falls into that. And I think we should mention, actually, you touched on BANS. If I recall correctly, BANS was the first group to survey patients directly about quality of life and their treatment. So that was a unique moment for Baypen way back then, because historically that decision was made for you, had you achieved a good quality of life in somebody else's opinion. So it's a very remarkable achievement there, along with everything else Baypen continues to do for patients. So given all of the activities Baypen does, and PINNT's very much part of that, Baypen's strapline is quite strong, putting patients at the centre of good nutritional care. I like it, it sounds good. What does it actually mean in terms of Baypen?
Yeah, it's a good point, Carolyn, and it is a big, bold statement, isn't it? And of course, we would, be pleased that you like it and we like it, but it's got to be much more than that. It's got to be meaningful. And just hearing you talk about BANS and some of the work that the BANS group did, and you were part of that, and the leadership of Maureen Orselia, who's an old friend of Baypen's. That's an example of putting patients at the centre of everything we do, in that there was, a proper survey of quality of life. In other words, understanding what the impact and the output and the outcomes are of the things that we do. And I think, in all honesty, we, are currently going through a period of reflection, if you like, conversation with ourselves around what this actually does mean. And we're a membership organisation, so most of our contacts are with healthcare professionals, and those healthcare professionals then have contact with patients. But it's really important that as a charity and as an organisation, we don't spend all of our time essentially administering an organisation so it financially ticks over, or, that you can spend all your time dealing with emails and policies and documents, and you lose sight of your core purpose. And our core purpose should be, and the judgments of whether we're successful or not should be, do we have a positive impact on the lives and outcomes of patients that are served by the teams that we support? So, what does it mean? We are on a journey to be really clear with ourselves about what that means, but we can't do that ourselves. We can only have a meaningful response to that question by talking to people like yourself and other colleagues within PINNT and other patient groups. So we're really clear that the work that we do has a really obvious positive impact for patients.
Would you like to briefly touch on some of the collaborative work that we took part in during the PN supply issue and COVID? There was a lot of activity behind the scenes that I don't think people fully appreciate.
Yeah, so look, I think organisations can develop in a really positive way whilst dealing with really unfortunate situations and crises. And very sadly and very unfortunately, patients receiving home PN have had a very, very difficult time over the last couple of years. Firstly, relating to the supply crisis, and then secondly, relating to COVID. And what I think we learned as an organisation, what BAPEN learned and what BAPEN did, was that we were seen as the go-to organisation to help sort this out. And we've got to build on that strength, because I think what we, I talked a few minutes ago about the concept of BAPEN being like a national nutrition support team. It's kind of a big NST on steroids, if you like. And that's what we helped develop to support, to deal with the supply crisis. So what we did in the background and worked with PINNT and yourself, importantly, to, we were talking on the phone 2 or 3 times a week. We had meetings with NHS England twice a week. There were daily telephone calls and email correspondence in the meantime to make sure that the system that was under intense pressure and crisis worked in such a way that we delivered the safest, best possible care we could for patients in otherwise really difficult circumstances. And, I think one of the broader learning points about COVID, and this relates to HPN services and what the journey we've been on over the last 2 years, is that when you hit a crisis, then what you should do in a carefully planned and structured way is to basically remove obstacles. And if you need to tear up the rule book, then tear it up. And I think, responsibly, that's what we did. We made the system work for patients rather than try and fit patients into a system that wasn't working.
Absolutely, Trevor, and I'm sure there'll be people listening to this saying things didn't go well for me, or whatever you did didn't work for me, or wasn't right. It's very difficult. Everyone was on a steep learning curve from the minute these crises struck. So whilst we try to fix things collectively, it's never going to work for everyone. But I think everyone should recognise the amount of work and effort that went into that. And I think because there was an established forum such as BAPEN with its core groups and its expertise, you're right, it was the go-to place, and it saved a lot of time in trying to identify people. So we were on the ball straight away.
Yes, I think that's right. And I completely recognise and acknowledge the comments that despite all that effort, and despite a feeling that we did some good, there were still lots of people that had very significant shortfallings in the care that they received. And I think some of those issues, I know some of those issues continue to this day. So the work that we did over the last couple of years was not restricted to what happened, 18 months ago. No. It carries on. It carries on. And so I suppose to come back to your previous question, what does it mean, putting patients at the centre of good nutritional care? What does that actually mean? How do you move beyond the strap line and make a meaningful statement from that big statement? And I guess the HPN supply issues and the COVID issues are a really good example around how we need to continue to develop BAPEN's role within the healthcare system. So we make sure that the NHS continues to see BAPEN as the go-to organisation, and we build on this experience, as unfortunate and as difficult as it was, see that as an opportunity for improvement, and we continue to improve and we continue to push.
And there's people like PINNT that are going to make sure that happens, along with the other patient networks. So that's great, Trevor. Thank you very much. We've put quite a lot of emphasis on our discussion about parenteral nutrition, obviously because that was just a dominant topic. But can you share some thoughts and insights into what BAPEN's doing about enteral feeding?
Yeah, so again, you and PINNT have been central to some of the internal discussions we've been having in BAPEN in recent months around how we might develop other important strands of work. So again, coming back to the point about bands, what bands identified many years ago now was that there are really significant gaps in care for patients on HPN. There was, for want of a better term, a postcode lottery. And in some areas, patients would receive a really gold standard service, and in others, there wasn't a service. And I think that we have been through that journey of how we try to improve services for patients in HPN, and I think there's been lots of success. It's by no means perfect. Yeah. There's been lots of success, and the conversations we've been having is to acknowledge that actually some of the significant gaps and problems with structure of care that we'd observed 10 or more years ago for patients in HPN are absolutely the same for patients receiving home enteral tube feeding.
Yeah.
In my own patch, that if you've got a particular postcode in Southampton City, for example, then you'll get one service. And if you've got another SO postcode that falls outside of the city walls, then you get a different service. And in some situations, you don't get any service. And that is, well, bonkers, isn't it? I mean,
Yeah.
no one could possibly defend that as a good model of care. So, I mean, many of your members will perhaps have seen on the news that there's yet another restructuring of the NHS. But again, I think we should always see these things as an opportunity. And the restructuring of the NHS is largely around trying to make regional models of care to try and even out services so we get away from this kind of postcode lottery. So there's an opportunity here, and we need to get in on this opportunity. Conversations we've been having is around how we bring together, again, a multidisciplinary team with PINNT, an important organisation, at that table to be clear about what good looks like. And what good looks like should be the same for every patient in every care setting, in every geography of the UK. But we need to be, as a group of professionals and patients, be clear around what's realistic and what's deliverable, and then advocate in the strongest possible terms with healthcare providers and healthcare planners to deliver that model of care.
It sounds idealistic, and let's just hope we can make some sort of inroad and contribution to making that happen. It also feels quite inequitable that depending on what therapy you end up on at home, you get a structured or an ad hoc service. It should be equality across the board, because it's just unfair. Yeah,
so equalities and inequality is a really important words, and we need to remember those, and we need those words, and we need to keep them central to how we approach this. I don't want to get into kind of healthcare policy, but the long-term plan, which is a vision for how we should be delivering healthcare in England over the next 10 years, is really clear that we need to address healthcare inequalities. And again, COVID has been another example of how it's really exposed the inequalities of health and care services that we provide in this country. So I think, coming back to the HPN example, one of the great strengths of the work that Baypen did and the advocacy that Bapen and PINNT and others undertook for HPN was highlighting the inequity point. And I think that we recognise and realise that that's a real issue for patients receiving home enteral tube feeding.
Great. Yeah, well, we'll all be working to the same objective, so that's be getting our full support in the future. So I'm just going to sort of come probably to the penultimate question, which is, given PINNT is a core group of Baypen, and we did the activity last year with the Enteral survey that some of our members contributed to, that was a great opportunity for patients to feed into some Baypen activity. So what are any future plans for receiving patient feedback, not just from PINNT, but other patient organisations?
Yeah, so that was a really valuable exercise last year, wasn't it? And there's important learning for us all around the value that brings. I think all organisations that are involved with healthcare, whether they're hospital trusts or primary care or healthcare charities, like Baypen, need to be, we all need to construct our business around listening to patients and having conversations with patients and carers and hearing about their experiences, because we as healthcare professionals, we might think that we know what patients need and want, but you will know, and you're being smiling politely, but that's not true, is it? And it's rubbish. We have a few hints and we have a few clues, but actually we need to provide a forum where we're having honest conversations so we hear that feedback. So, we don't have a direct relationship with patients, if you like, in terms of patients can't, or members of the public can't join Baypen. We can and should develop the relationships that we have with PINNT, and we have started to develop other professional relationships with other patient groups. So one example is the Motor Neurone Disease Association, and patients with MND will all have nutritional care needs, and so by fostering those links with these different charities that have patient care at the centre of everything that they do, I think that's how we, address what that means. We're having conversations with patient groups rather than conversations with ourselves.
So do you see in the coming years, maybe months, let's try and be a bit optimistic, there will be some sort of patient forum stroke network within the structure of Baypen?
Yeah, so there's a challenge, isn't it, Carolyn? Nothing like
putting me on
the spot.
You know me.
Yeah, and so quickly to come in on that point for your members that perhaps don't see what you do is being really constructive challenge to the work that we do and push us in the right direction, and that's of enormous value. So do we have a vision for having a patient network in the next few months? Well, yes, but we've got to turn that vision into something that's deliverable. So when you talk to me next time, it's, well, show me what you've done or what we've done.
I'll make a note of that question, Trevor, and that'll be our topic for next year. I'm going to really thank you for your time. I'm going to wrap this up because I want quality, not quantity, for this chat, so people actually understand the essence of Baypen and the importance of collaboration. But more importantly, the aim of this discussion today is to raise awareness of our collaboration with you and Baypen's existence. So thank you very much for your time this evening. PINNT remain a staunch supporter of what Baypen does, and good luck with all the plans. And we hope you'll be liking and sharing a lot of our activity on social media this week. So thanks for your support tonight and for the future.
Yeah, brilliant, Carolyn. Thanks so much. Thanks for inviting me. We value you hugely. Brilliant news for a brilliant hand week. So well done you, and thanks so much.
Thanks, Trevor.